Konekt. Kupata information unataka. Konekt. Life ni journey pia ni process. Konekt. For every step una make, it brings a different outcome. It always comes together. Everything in life is a process. Life is a journey. Believe in the process. Everything in life comes together. Life is a journey. Believe in the process. Inspiring, informing, and impacting. This is the Konekt.
Amazing. What's up, my people? What's up, everybody? How you guys doing today? Man, it's just an awesome, beautiful day. Second day of October, yes. It's glad that we have you on tonight. Thank you so much for tuning in on the Connect. Thank you for always tuning in. For those who have been tuning in every Saturday, we see your love and we're saying thank you. We really feel that love. May you continue supporting us and always being with us. And we endeavor to bring you all the great stories, all the information you need to make informed decision. Thank you so much. And tonight we have a great show lined up for you, wherever you tuned in. You might be in any state here in Australia, or maybe all the way back overseas, wherever you are, feel at home. So today we have a special edition for you guys, and we have a doctor on. She's going to talk about vaccines. And if you have any question, guys, at the end or the second side of this show, please write your questions. Bring your questions on, and we want to hear from you, and we'll attempt to answer all those questions. So today I'm really excited because I have a co-host with me tonight. I'm not gonna host the show tonight. She's gonna host the show. She needs no introduction, and she's been doing great things within the community. She pushes herself. She wants to do great things, and she asked me just out of the blues, can I come on and join you to in this journey? And I was like, why not? Come, let's do it together and see where this thing goes. And today I'm privileged to, yes, to welcome Jackie on the platform. She'll be the one hosting the show tonight. She doesn't need any introduction. She's a mother, she's a wife, and she's a very loyal community member. Tonight, Jackie is gonna take over the show. So please give Jackie a very, very warm welcome as she takes over and leads the show tonight. So Jackie, over to you.
Thank you so much, Pete. How exciting. Thank you so much for the wonderful opportunity. And as Pete has said, I requested the opportunity. And what a joy it is to be here today, sitting on the other side as the host. And I really do look forward. And please stay put. We're going to have a great time today. And I know you love this show. So without any further ado, today, we are talking about COVID-19. I was actually reflecting and thinking in the past 2 years or however long it's been around, I don't think there's a day that's gone by where any one of us has not said that word, COVID-19, or talked about a pandemic or anything related to it. So today is such an important topic because we're going to discuss something that really matters to each of us, COVID-19 vaccine. We're going to get the facts, we're going to debunk the myths, and with us today, we have the wonderful pleasure of having Dr. Horata. And from now on, I'll refer to her as Horata to talk to us about this. So before we embark on that journey, it may be worthwhile maybe starting with a bit of an introduction. Who is Dr. Horata? Who is she? So she graduated in 2014 from Monash University, and prior to that, she had completed her Bachelor of Science degree at University of Botswana. She's hoping to join the Royal Australian College of General Practice to train as a GP in 2022. She's also a potential PhD student with Swinburne University in the areas of sport and sport policy. And her main focus, and I'm really excited about this aspect, her main focus is Africa. So her special interest, she's interested in women's health, So hopefully we'll have her again talking about that, musculoskeletal issues and injuries, autoimmune conditions, sports medicine. And before I tell you about what she enjoys doing outside of this, maybe if I just briefly tell you a bit more about her. So she has been practicing in medicine for 7 years. 7 years, graduated in 2014 from Monash University. So as a medical doctor, she has experience and interest in sport, in emergency medicine, in primary health care, and she enjoys research work. So she has a strong desire to work in research, to translate knowledge, to develop initiatives and policies in the area of medicine and in the industry of sport. So that sounds like a very, very busy caseload with her research and her other interests. But she does make time for herself. And she says in her personal time, the things you'll find her doing are running. She enjoys running. She enjoys reading. She enjoys journaling. She enjoys catching up with friends and family. And most importantly, having a coffee. That's an important one. Enjoying a coffee. So please help me welcome very warmly the one and only doctor on this platform for the first time, Dr. Horata. Welcome, Dr. Horata. We're so thrilled to have you. Please, as we embark on this, maybe that was me reading out about you. Maybe if you can just tell us a little bit about in a snapshot, like a really snippet of you. If they hear it from you, tell us who you are. Who is Dr. Horata?
Hi, thank you so much, Peter and Jackie, for having me tonight on the show. And thank you, everyone, for joining us. So I'm Gorata, so I now grew up
She's
in
on her own on
Botswana.
this one.
So spent most of my adult life in Botswana, so young life and adult life in Botswana, and I came here in at the age of 20 to come and study medicine, and I have stayed. However, I'm going back to Africa hopefully to go do and transform the area of sport. So that's me.
Yeah, I love that so much. Going back to Africa to transform the area of sport. And do we need that? We need that intellect back in Africa working wonders. So thank you so much, Dr. Horata. And now my first question for you is around the vaccine. Firstly, if we start from the foundational basic understanding, if you can tell us what is a vaccine?
So a vaccine is actually made to train our immune system to actually develop antibodies against a particular disease, for example, for polio and COVID-19 vaccine. So the idea is that the body is trained before the introduction of the disease so that it actually have memory to fight the disease. So basically it reduces the burden of the disease if somebody is to contract the disease.
Hmm, very
Yeah.
good. Yeah, and I think that's an important thing for our viewers to understand is how it actually works, the science behind it. And thank you for capturing that so concisely to assist us. Now, from there, then we talk about the different types of vaccines. And I know in Australia, we've predominantly looked at two main vaccines. So I'll get
next week, 7:30, same time, same venue. We're having a doctor and we'll be talking about mental health. Yes, guys, mental health, you heard it. So if you have any question, if you know someone who has a question about mental health, guys, don't forget to join us next week, 7:30, same time, same venue at the Konect YouTube channel. Thank you so much for tonight. Thank you, doctor, for whatever you're doing and everything that you've done tonight. We just want to say thank you. And all the people who are watching tonight, say thank you for your time and supporting this channel. And don't forget, before you go, just subscribe, leave some love, leave some likes, some share. And if you have any question tonight, guys, we are waiting for your questions. So write all the questions and put them down on the comments down below, and we'll endeavor to read your questions and to always answer your question to the best of our ability. But other than that, thank you for watching. Thank you for joining us tonight, and I shall see you guys next week, same time, same venue at the Konekt YouTube channel, and it's back to you at the studio.
Welcome back. Welcome back. Glad to have you. And I've just got a comment here that I'm seeing from Betty. Very important topic. Loving your interaction, ladies. The microchip, is there scare? Is there any truth there? So, Dr. Horata, I think I'm going to bundle Betty's question with my own question around this. And please put through your Q&A questions. Now's the time. We're entering into the Q&A space. So, Dr. Horata, there, my question for you, and I'm bundling this with Betty's question there is, these scares that people have, how are you as a medical practice, as practitioners, how are you addressing the very real fears that your patients are coming with? You know, so yeah, so just one of those being what Betty is asking about the microchip, and others. There's many that are bound. How are you addressing them as doctors when you have your patients come into practice? Thanks.
So I guess what I normally do, so because I work at NIM, it's normally like people with chronic fatigue disease, and most people that I see also have got immune conditions. Um, what I normally do is give them my experience. So I had an opportunity to work in Africa in 2020 during COVID-19, when we didn't actually know what it is, what's going to happen, and everything. But my experience is that once you're in the ventilator, it's very hard to actually come out of the ventilator in ICU. So I'm very lucky to have had this first experience, and I tell my patients about it. That it's actually better to have the vaccine than actually have the disease, especially for those that are immunocompromised, especially for those that have, have chronic fatigue or have got any other chronic illness. And I use myself as an example that I've actually had the COVID-19 vaccine, because I believe that it actually works, and I don't want to get sick and end up in ICU. That's what I normally do. And the other thing is that we've never actually lived in a pandemic before, and we've had vaccines in the past. We have vaccines now that we give our children. Why can't we have a vaccine now, which is for COVID-19, where there's a pandemic? So I try and use myself as an example, and I try to use examples, um, things that I actually experience or have experienced clinically. And just if they're questioning whether their immunity is going to be affected, I go, well, in that case, just make sure that you get the vaccine at a time when you're feeling really well, and also support your immune system. Um, the other thing is microchip. I'm like, I actually look at the ingredients and tell them the ingredients that are actually in the vaccine. And one of the preservatives is PEG, which is and actually these are very clean vaccine compared to like other vaccines where they actually have metals, but these ones don't have any metals in them, so I don't think they have microchips in them. And if people are questioning, I guess, that they are being experimented on, I just let them. I just say bring them to to remember that the more we delay, the more we get another a different kind of the virus, which is probably gonna be more resistant. So let us vaccinate more so that after this, when we have it all under control, we can think about the boosters.
Yeah. So there's this question from Perita that intrigues me. And she asks, is it true vaccines were approved for a temporary experimental basis and that in the near future they will not be in use? So that has been a big one circulating, and I think it has also perpetuated the fear around the vaccines that these are only experimental drugs and people do not want to be experimented on. So do you want to comment on that one, please?
Um, I do, with my little knowledge, I do not think that these vaccines are experimental. For example, the AstraZeneca, we have, when you look at let me go back. When you look at the mRNA, the vaccine, it has actually been trialed in different viruses, like the Zika virus, and obviously we haven't actually succeeded in making a vaccine that's mRNA. However, due to the pressure of the pandemic, they have actually managed whatever they couldn't actually overcome before with the Zika, they've actually overcome with the COVID-19 vaccine. It is not an experiment. If it is an experiment, it'll be a really deadly experiment over the whole world. And yes, there is monitoring. The only reason why they're monitoring is because it is a new vaccine. And yes, I understand that we don't know. We have no studies of what actually happens after 2 years, because right now is actually a forward-looking study, which of course we are part of that study. But I think it's better to prevent rather than actually wait and see how the pandemic is going to end up, because I know from Botswana that due to like a lack of due to low vaccination rates, we actually have ended up losing a lot of people due to COVID-19. So from that, I think it's better to vaccinate, and also just wait, I guess, for another couple of years after being vaccinated to see what actually, yes, the long-term effects are of this particular vaccine.
Yeah, so Horata, then the next question is around reactions to the vaccine itself. And Betty asks, have you come across any allergic reactions? And then I'm going to take it a notch higher. So if you can answer these two together. So Perita sounds like she has a medical background because she goes, what time frame do you reckon the severe symptoms are likely to occur? For instance, the myocarditis, pericarditis, and endocarditis, and what are the earliest symptoms? So we're talking here reactions. So initially, reactions you have come across, allergic reactions from the vaccine, and then secondly taking it to the next question, which is around the severe symptoms, what time frame for these to actually occur?
So with this severe reaction, I have had like as mentioned, I had that particular woman who was on contraceptive pill, just started it, and also was given AstraZeneca, who ended up with a massive PE, was hospitalized for a couple of days. And one other reaction that I've come across, it was skin manifestation. So this person developed urticaria in different parts, which actually took forever for it to disappear. So in those cases, for example, at the Austin Hospital, we do have under infectious diseases unit, we do have an area. If somebody does report a reaction, and it's actually a reaction that we can see, we can send them back to the COVID vaccine clinic, whereby if it is a reaction that is real, Some people get injections that actually, um, what's the word? It alters the immunity that when the second vaccine is introduced, then you're less likely to react to that. So there is things in place for people who actually react to the vaccine. One other extreme case that I had, it was one of my friends who I worked with in the COVID-19 quarantine project. She had the vaccine and ended up it was more like an anaphylaxis reaction, ended up in the Alfred in next to not intensive care, but she was closer to that, but she was given steroids and everything, and she was advised not to get the vaccine. If it is in cases of anaphylaxis, then the advice is not to get the vaccine. However, other reactions, they can actually be managed, and we can actually give injections to actually modify the immunity or the reaction to the vaccine. I don't know if that makes sense.
It does make sense. So just thinking about the government, particularly I'm talking Victorian government's reaction to the COVID situation. I think we're now at the place where they're basically saying, no jab, no job, I think is how it's been put. No jab, no job. Do you think this is an accurate way of addressing the pandemic? Is it at that level that we need to mandate that every workplace people need to get vaccinated? Is that where you think we are? Is it an overreaction by the government, or do you think it's a justified response?
I don't. I think getting a vaccine should be a personal choice, and we already have valid reasons right now to encourage people to get vaccinated. And I kind of disagree with the government saying no jab, no job, because I think from this we're going to see it's not now, it's going to be years later. We're going to see a lot of legal actions from this particular. I guess a decision. So I don't particularly agree with it. I don't know if you saw the article. It was from the Age or Financial Times that Walid, who works in the project, who wrote, I guess, his view about no jab, no job. And I agreed with his view because right now, at this moment, we've actually, like people, especially when we look, for example, when we look at the construction industry, that people have gone from working for actually a company to going to working for themselves, that entrepreneurs that they own their own businesses, right? So therefore doing that is actually attacking them individually and their own family, so which is actually not fair. Is there a way, is there a strategy that we can encourage people to get vaccinated without actually um, uh, saying they're going to lose a job, so which is not fair? Because yeah.
Hmm. Very good. So, to our viewers, I'd really be keen to hear your different thoughts. It could be a comment, may not necessarily be a question. So, please put them in the comment section. I'd love to read what you have to say or what you have to ask or a comment you want to make regarding this very topic that we're discussing. But, Horata, just on that point around the no job, no job, and thinking that may well not be the approach. So, can I then give you an opportunity right here and now to speak to those who are viewing? Why should they get a vaccine? Why? Like, if in a segment, why should they get this?
I think I don't know. I don't know. I'm gonna speak for myself. I'm really tired of the lockdown. If we can get vaccinated so that we at least 80%, so that a lot of people are vaccinated, which allows the borders to be open, which allows the lockdowns to be lifted, because what is worrying is the rise of cases And if cases rise when people are unvaccinated, that means the burden in the hospital is going to increase. So I don't know if people know right now. So the other day in emergency, we had to shift our emergency section to open up more COVID-19 beds. So that means that a part of the hospital has to close. And we go, which part of the hospital can close? So we sacrifice one part of the hospital which means that is elective surgery. And I've seen people coming in with really sore hips, and we label that as osteoarthritis, but they are in pain. The so they're in pain, and we can't do anything because there is a backlog in the system because of what we're dealing with now. So if we can get vaccinated so that the burden is not as much in the hospital system, that'd be great. And so that also, and also it's for individual reasons, so that when somebody contracts COVID-19, they don't actually get super sick. So that they can just get sick, but not as sick, severely sick, not to end in the hospital. So those are the things that we're trying to do, or that's with people
Very
getting vaccinated.
Yeah, that's awesome. Thank you.
Mm.
And I'm really appreciating Perita's interaction here. And she's got another question. So, if they can't get the vaccines because they are anaphylactic, so how are they going to be protected? Are there other strategies that are put in place for such patients, so to assist such patients?
Uh, that's a very good question. I actually don't know, but what I do know is that there is actually. I was listening to this. I don't know if it was from a podcast. So right now, Mac, the company Mac, has actually developed a drug which actually is under trials now. So it's getting approved by the US government to be trialed for patients, which actually reduces the disease or the mortality and the burden of the disease by 50%. So I guess if that drug is actually successful, and if somebody has got anaphylaxis, if we don't have any other option, that we can actually say this is the drug that you can take in case you get COVID, so that you don't actually end up in the hospital, or that it actually reduces mortality by 50%, which is great. So there's still clinical trials in the background by the pharmaceutical companies, drugs, vaccines, and everything. So I think we shouldn't give up because there's still more research being done behind the scenes.
Very good. Thank you for that response. Now, let's take it a bit personal now, Horata. Just coming to you, in light of where everyone is at, there's just been so much happening round about us. We just so much, we're inundated with so much. And then, of course, with your professional practice, it means that there are things that you come across that may well perturb you, that leave you worried, that, leave you with a burden. So I want to know about yourself. How do you care for yourself? And I'm thinking about your mental health, even your physical health, just the holistic you. How do you care for yourself day by day to ensure that you're still operating at your optimal level?
Right now, which I acknowledge that it's a very tough time for everyone, especially in Melbourne or Victoria where there are lockdowns. I have resorted to exercising at least 3 times a week. So I just force myself to exercise, whether that's a walk or skipping or weight or just watching something online, following that. I also, my reading levels have actually dropped. So I read at times, and I've been busy doing my research. So I've just went head on into my research. And I like around the circle. I've got a couple of my friends that are within um, my radius, so I go for walks, for coffees with them, just to keep myself sane. So yeah, and my partner as well. I go and see my partner every now and then. So
Very
that's what
good.
I do. And what I would advise people to do is connect, whether connect that person that you're thinking about, shoot them a text, call them via FaceTime, via Skype, whatever you can use. Go for a walk. If you're not an exercising kind of person, just make sure there is some kind of movement involved, and talk about, if there's something, talk about it, and journal those feelings out, because I find that they can be, feelings can be so overwhelming, especially during these times of um, lockdowns, or yeah, during these situations.
Hmm. Very sound counsel. Thank you so much, Horata, for that. Thank you. And it really is good to recognize that much like each of us doctors also contend with the burdens that we do. So I'm really pleased to hear you share those tips with us as an audience. And so now we're about to get towards the close of our time together. And it's amazing how quickly time on air goes. It's not like normal time. It's like, the time we have is truncated somehow. So I'm really interested in first, actually, before I even say this to you, Horata, I just want to acknowledge each of you who have logged in, tuned in today. I actually got a comment from a friend of mine in the States and said, thank you for introducing me to this channel. He'd been talking for the longest time about relocating to Australia, doesn't really know where to start, what to do. Yes, may ask Jackie, but Jackie may tell you something and move on with her life. But here we have a place they can connect. So I'm really, really pleased and excited to be part of what is happening with the Connect. So please tell a friend. They don't have to be in Australia. I can tell you, an American, and I'll get him to watch this episode, is talking about the benefit of this show. So let's link each other. Information is power. We all need what this channel is bringing. So I'm encouraging you, please get someone to tune in, and yourselves, thank you for being part of this. So Deng Yong, Deng, I see you. Betty, I see you. Harita, I see you. And every other person who's not on the comments but is tuned in, I do see you and I acknowledge you. And thank you for logging on and tuning in to be part of this show. So now, Horata, over to you. What I'd like to hear from you are your closing remarks. Anything you want to leave our viewers with, the platform is now yours. Thanks.
So I think let's get vaccinated to get the borders open, and also so that our hospital system is not overwhelmed, so that we can just move forward. Take care of yourselves, take care of each other during this time. It's an unprecedented time. We haven't lived through a time like this before, so let us be kind to one another, extend those, I guess, kindness thoughts towards each other, and pray, meditate, whatever that actually keeps you sane. Keep doing that, and yeah. And thank you so much, Pete, and thank you, Jackie, for having me on the show. It's been great, and we'll spread the word.
Yeah, fantastic. There we have another subscriber. Dr. Horata is part of the Connect family now. So we're really pleased to have you, Horata, and thank you so much for your time and for that acknowledgement. When I thought about, my closing remarks, and I just want to make my own closing remarks now. I thought about my closing remarks and, really pondered what it is I want to leave our viewers, to leave you and even myself with. And I thought about what health is. What does health represent? And I found a quote that says, the greatest of follies is to sacrifice health for any other kind of happiness. And then it goes on to say, it is health that is real wealth, not pieces of gold and not silver. And I thought that is so profound. Say I amass all the wealth. Say I get myself all the fortune. Say I get myself all the things my heart desires, but I do not have health, then I cannot enjoy those very things that I'm working and laboring so hard to get. I think this was a very vital topic for us to discuss because it touches on our health. It touches on an issue that we have not come across in the recent past. And so now we know and we have the information. So please, now that we are empowered, let us use this information and allow ourselves to enjoy optimal health so we can go on to achieve the things we'd like to achieve. So thank you so much, every one of you. You know, if there's any other questions, you know, we or the chat box on YouTube is always open. Leave a comment on there, and I'm sure Peter or myself or someone else will jump on and we'll address that and link with Dr. Horata if necessary. So thank you so much, Horata, for your time. Thank you, Pete, for entrusting us with this segment or this show today. We appreciate you. We appreciate what this is doing, the Konekt. And to each of you, stay empowered, and we look forward to the next show. So please, we look forward to seeing you next Saturday. Come charged for what we have in store for you. Thank you so much and have a good night. Thanks for joining us.
Thank you.
Hi guys, and thank you so much for joining us live today on YouTube, man. We're so excited. Hi guys, thank you so much for joining us tonight. We're glad that you could actually make it and join us on our live session.